Now let's speak with Mike Clark from Natural Biohealth.
Hi, my name is Mike Clark. I'm actually the Director of Education Research of MBH Lifetime Health. We've been in the hormone business and the weight loss business for about 12 years. Well, in the early days, of course, not a lot of people knew about bioidentical hormones, so it was relatively new. So we've been spending time building up the business, getting the word out to a lot of people. There's still a lot of concerns about hormones. There was even more during those years. But obviously, there's nothing better than hormones as far as making you healthy, solving a lot of health issues you have. So we've treated thousands of patients since 1999,
Really?
and they've all benefited incredibly. Well, we have patients that have been with us for 12 years, so we hear they must be doing pretty well.
Yeah.
We have a recent case where a lady's been on our program for about 4 or 5 years. She comes from another state, actually. We're in the state of Texas. We have 4 clinics there. Anything from their knees heals to their shoulders heal to their PMS no longer exists, to their heavy bleeding, cramping headaches no longer exist, to their migraines no longer exist, to they feel better than they've felt in years. When we hear those type of comments all the time. They've lost weight they've never been able to lose. We firmly believe that most hormonal issues actually affect weight loss, and the reason people typically regain weight and they can't lose weight is because of lack of hormones. Our patients tend to stay with us. They've been with us for years, and we have a big referral business, needless to say. So yeah, it's always rewarding to see how the patients benefit. Well, there's nobody better than Dr. Rouzier, obviously. We follow his protocols almost exactly we have for years. I have to talk a little bit about my personal benefits. I'm 64 myself. I take all the hormones, testosterone, growth hormone, thyroid, DHA. My wife has been taking hormones for 12 years. One thing we've learned over the years is hormones are great for you. They're a missing element for most of us, but diet, exercise, supplementation, they're all still a very important part of obtaining optimal health. So we do recommend a lot of supplements, but mostly supplements designed for specific health issues. I mean, you obviously know about D3. That's one that we give to everybody. Molecular distilled fish oil is another one that we pretty much recommend for everybody. So there's some basic ones that we recommend for most people. We recommend to get their hormones tested first. As Dr. Rouzier often says, you look at the symptoms, but the fun thing about hormones, what we tell our clients is you don't have to take our word for anything. We can test. Then in a short time you know that they're working for you, whatever ones you might need. Then the third thing, of course, is you can retest to find out if your levels are where they're supposed to be. You don't have to believe us. We can give you lots of science, research, but more importantly, the patient knows that they're working for them, usually within 30 to 60 days. And then the lab tests just kind of verify that you're at the proper levels. Like I said, we have 4 clinics in the state of Texas. I go to lots of Dr. Rouzier's courses, probably been to about 30 of them over the years since 1999. We always learn something new, things are changing.